Today I'll be discussing about hematology practical examination. Now let's move to the blood smear cells. So what are the normal cells you see in a normal blood smear? You see RBCs, WBCs and platelets. So these small pink color cells which you see are the RBCs, and in the background you can see the WBCs which are larger than the size of the RBCs. So on the top you can see a neutrophil, and below you can see a beautiful spectacle shaped cell which you call it as eosinophil, and in between the RBCs you can see the purple color dots, you call it as platelets. So these are the normal cells which you see in a peripheral blood smear picture. So other than neutrophil, eosinophil, you can see other WBCs as well. So what are the other WBCs? Basophil, monocytes and the lymphocytes. Moving on to the first case. So today I'll be discussing only about the RBC disorders and the WBC disorders. So these are the benign conditions in peripheral blood smear. So microcytic hypochromic anemia. This is a case of 70-year-old female presenting with dyspnea on exertion, easy fatigability, and you can see the CBC count and the peripheral blood smear picture which is given here. So on the CBC counts, the hemoglobin RBCs are reduced, the RBC indices, the MCV which is very much reduced, which is 56 femtoliters, MCH is reduced, MCHC is reduced, and the RTW is increased. On the right side you can see the peripheral blood smear picture, and you can see a big arrow which is pointing towards a small lymphocyte. Why this is given? Because to compare the size of the RBCs, you always compare the size of the RBCs to that of a small lymphocyte nucleus to comment on the size of the RBC. So when you compare here, the size is very much reduced, and also the pallor which is increased in the center. So the RBCs are microcytic and hypochromic. So with the clinical history, the complete blood count findings, and with the peripheral blood smear, what is your diagnosis? So the diagnosis will be iron deficiency anemia, microcytic hypochromic anemia. And what are the additional investigations which are required, and what is the likely diagnosis? So iron deficiency anemia. So how do you describe the peripheral blood smear? So this will be kept as a spotter or your major examination. So you always comment on the RBCs first, then the WBCs, and then the platelets, and also don't forget to comment on the parasites. So the peripheral blood smear picture which is showing microcytic hypochromic RBCs. So when do you say microcytic? When the MCV, the mean corpuscular volume reduced, RBCs are smaller than the size of the small lymphocyte nucleus, hypochromic RBCs with anisocytosis. What is anisocytosis? It is the variation in the sizes of the RBCs. So when there is a variation in the sizes and the shapes of the RBCs, the RDW is increased with many elliptocytes and leptocytes. So these are the variations in the shapes. So these are the different shapes, elliptocytes and leptocytes. Leptocytes and elliptocytes. So the variation in the shape you call it as poikilocytosis. So there is anisopoikilocytosis. So what are the additional investigations you do? You do the serum iron studies and the bone marrow studies. So the likely diagnosis will be iron deficiency anemia. Here again you are seeing a picture of a blood smear which is showing RBCs and a small lymphocyte. So you can see anisopoikilocytosis. The RBCs are reduced in size. Few small small RBCs are seen, and also elliptocytes are seen. The red blood cells are microcytic since many are smaller than the nucleus of the Lymphocyte, the erythrocytes are hypochromic with increased central pallor. Elliptocytes and pencil shaped form cells are present. So these pencil shaped cells are most commonly seen in microcytic hypochromic anemia. So this is another picture showing microcytic hypochromic RBC. So all the cells here are smaller in size and the central pallor is increased. So after your my peripheral smear examination is done, you will be asked viva questions. So in your viva, the first question will be define anemia. So what is the definition of anemia? Anemia is functionally defined as insufficient RBC mass to adequately deliver oxygen to the peripheral tissues. So according to WHO, when do you call it as anemia? When the hemoglobin count is less than 13 grams per deciliter in males and 12 grams per deciliter in females. So what are the most common causes of anemia in elderly? So these are the causes of anemia. And the interpretation based on complete hemogram. So what are the different types of anemia? So this is also another important question in your viva. So one is microcytic hypochromic anemia, normocytic normochromic anemia and macrocytic anemia. So what are the common causes of microcytic anemia? First will be your nutritional causes. So nutritional anemia, mostly it will be seen in children and in pregnancy. Then chronic blood loss and cases of anemia due to chronic diseases. And what are the investigations? Iron profile, stool for occult blood, gastroscopy, colonoscopy for any bleeding, ultrasonogram and pap smears to be considered. Normocytic normochromic anemia. So when do you get this normocytic normochromic type of anemia? In chronic renal diseases, malignancy, acute blood loss and hypothyroidism. And the investigations are given here. And macrocytic anemia in B12 deficiency or folate deficiency, myelodysplastic syndromes, chronic alcoholics, hepatic diseases and some cases of hypothyroidism. So investigations will be B12 and folate assays, liver function test, peripheral smear and bone marrow studies. So in case of microcytic hypochromic anemia, these are the investigations which are to be done. Your iron profile, then the reticulocyte count, then the ESR, gastroscopy, colonoscopy, urine for blood, CBC and peripheral smear examination. Next case will be a case history. A 43-year-old man presented to the student health service with chief complaints of intermittent fevers and the blood count was 7.2, hemoglobin 14 gram per deciliter, hematocrit 42%, mean corpuscular volume of 94% and manual differential showed 86% of leukocytes, 11% of lymphocytes and 3% of monocytes. So describe the peripheral smear. What are the causes of intermittent fevers and what are the different types? So you can see the picture given here. It's a peripheral blood smear picture showing RBCs, and inside the RBCs you can see beautiful ring forms. So these ring forms are seen mostly in parasitic infections. So how do you describe the peripheral smear? So many of the RBC contain one or two ring and occult forms of hemoparasite Plasmodium falciparum. And why is the fever intermittent? So usually in parasitic infection, the fevers are present with chills and rigors, and also the fevers are intermittent. Malaria causes intermittent fevers caused by intracellular parasite Plasmodium. So what are the different types of Plasmodium? Plasmodium vivax, oval, malaria and falciparum. So the malaria causes quartan fever, falciparum causes malignant tertian fever. How does the parasite appear in the blood smear? So inside the RBC you can see central pallor. Pallor is increased in case of parasitic infection, and also you can see the ring forms. Again you're seeing the ring forms inside the RBCs. So what is the etiology? The species which causes malaria are Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malaria. So what is the mosquito which causes malaria? It is the female Anopheles mosquito. Moving on to the next case. So what are you seeing here? This is a WBC. You can see 3 lobes which has 3 lobes, and the cytoplasm has few granules. So which WBC are you seeing here? This is a neutrophil. So neutrophil will have 3 to 5 lobes. So on a peripheral blood smear, when you see more than 5 WBCs on a high power field, you should suspect of increase in WBC count. So if you see more than 5 neutrophils or 5 eosinophils, so so you should suspect of any neutrophilia or eosinophilia. So this picture you can see around 10 neutrophils in this field. So this is a case of neutrophilia. Again you are seeing many neutrophils. So it has more than WBCs in this field, and the lobes are 3 to 5 lobes. So this is how you draw the neutrophilia picture in your exams. So you always draw the picture, then you comment on the RBCs, WBCs, platelets and the parasites. The RBCs you should write as normocytic normochromic. WBCs which are increased in number of neutrophils having 3 to 5 lobes with fine purplish granules in their cytoplasm, and some shows toxic granulation. So when you have any infections like fever, you will have this toxic granulations. What is this toxic granules? The granules are more hypochromatic and you'll see vacuoles in the cytoplasm, and the platelets will be adequate, parasites will be absent. This is another WBC. Hope you all know what WBC this is. This is an eosinophil. You can see a spectacle shaped nucleus, that is bilobed nucleus with fine red granules, okay, red to brownish granules in the cytoplasm, because this likes most this is a cell which likes acid. So this is this takes up the stain eosin, and you can see the fine red granules. So this is the acid loving WBC. So in this field you can see around 5 eosinophils. When you see this dark red color, red to brown color granules, you should suspect of eosinophilia. Again in this field you are seeing many eosinophils. In your exams you should draw the eosinophilia picture and comment on the RBCs. RBCs will be normal, normocytic normochromic. WBCs increased in number of eosinophils which has bilobe nucleus with reddish orange coarse granules. So the granules will be reddish to orange coarse granules, and the platelets will be adequate and parasites will be absent. So the next video will be on leukemias. So this is part 1 hematology slides, and part 2 will be discussed on the next session. Hope you all would have understood about the anemias, iron deficiency anemia in malaria, parasite, neutrophilia and eosinophilia. Thank you for watching.